I'm excited, and as I welcome you, I want you to have lots and lots of fun. First guest of honor, Mr. Mufakwadziya from the Ministry of Health.
Section 3, I will not go much into detail about it, but we have specific areas that we have made sure that the friendship bench is part of those specific areas. Why is that important? So that when we are cascading the program, it's within what we can call local constitution. So when we cascade the program, it means it's going to be replicated kushika. So we are very glad kuti triple level E, and as we go on, we implement this at primary care level, at workplace, and all the other various places, even at tertiary care level, so that this service we are able to receive it at every level of healthcare. So I want to go on further about, we talked about training packages. So what we're going to do is we are creating packages for training, and friendship bench is one of those important models that are going to be found within those packages. Why have we found it fit? Because this is the only problem-solving therapy model that we have in there. So it's very important that most people know about it, and I'm glad the friendship bench is receiving a lot of media coverage. It's very important. Why is that important? Because everyone has to know about it before we are trained to be able to conduct it, but there has to be some level of knowledge, even to every person on the street, that there's a program that we are running that is like that. So I'm very grateful that we're all gathered here, and I urge you to be the ambassadors of this program, so that when it goes to everyone else out there, they are going to hear it through you. So thank you very much. So with those few words, I don't know what qualifies as few words, but I would like to call Dr. Machando. So thank you very much. Thank you.
Good morning, ladies and gentlemen.
Good morning.
It's exciting to be here. And how many of us know that the friendship bench originated in Zimbabwe? Raise your hands. How many of us know that it's now an international program? Raise your hands. Okay, so how many of you are proud to be Zimbabwean and to... it's really exciting to be part of this program. What it looks like is as Mr. Mufakwadziya has said, Zimbabwe has reviewed what's going well and looked at the gaps in mental health, and then identified what we need to do to strengthen mental health systems. That mental health services are a matter of life and death, that they affect you, they affect me. Okay? So what we would like to do, what the Ministry of Health is doing, is to strengthen mental health at systems level, looking at the communities, and you fall into the communities. So we are not looking at this as a once-off program. We are looking at organizations that have been strengthened, and because you belong to those organizations, you can offer those services in your institutions. We anticipate a situation where we are going to have all organizations in Zimbabwe having a mental health component in their health systems. So I want to emphasize this so that you know that it's not just a once-off training and it's done. You get your certificate and it's done. You are actually going to be part of a system, a nationwide system that rolls out mental health services, that offers mental health services in different forms: awareness, prevention, promotion, treatment. So this is how important you are in Zimbabwe's mental health systems. Please put your hands together for yourselves. Okay, so we know that a lot of people go through so much training, and half the time they don't use what they train, they don't implement. It will be very sad. I'd like to urge you to make sure that you are going to use this information that you have. The beauty about mental health services that you get transformed along the way. I could, as I listened to you, you can actually hear the therapeutic voices, the language that people are using already. So let not this be a certificate that you're going to sit on, but let it be the beginning of a whole transformation of mental health services. How are we going to do this? You guys learned from the best. I have listened to Dr. Makoni, I have listened to the Friendship Bench team, and I'm quite sure that you are well equipped. You are actually skilled to be able to make a difference in people's lives. As a lot of you are saying, just being known, you are someone who can listen, someone who can, someone who is approachable. So let's not even undermine the skills that we have. If 3 executives already sought help, imagine how much more difference you're going to be doing in your organization. I also want to highlight for us to not be confined to just thinking that we're going to help people in our organizations. I really appreciate what I've been hearing. People offering these services at church, people offering services in the neighborhood. Being known, please put your hands together for sis. Yes. So yeah, let us be those people where when people give their testimonies, they'll say, if it was not for Sis Shoops, where would I be? Companies that we are hearing here are not your small companies. These are your busy people in Zimbabwe. Please go be the ambassadors. Use the strengths of the value of your organization so that people can buy in, because we really need to make sure that people get engaged, people know that Delta was there, ZTDC, they might be angry a little bit, but maybe they will know that you are now working on solving problems instead of creating them. So we really want to appreciate the organizations. For this program to go and fly, it's the feedback that you're going to give. The feedback that you're going to give about the training, the feedback that you're going to give about the work that you're doing. Don't even undermine these anecdotes. When you give your feedback and you give, anecdotes respecting all confidentiality, you'll be amazed what difference it makes. Because a lot of people have challenges, but they cannot quite relate on what mental health issues are. But when you talk about the challenges that people face taking care of children with disabilities, the description that she's giving, when you wake up at 1 a.m., who are you going to call? When you give that feedback, it's got a way of reaching out to the everyday person, okay? So the advantage that we've had with the Friendship Bench program is that it's very well structured. It's got the different stages, the different protocols, the different screening tools that you have. So you are just going to adapt, as she said, and make sure that you are, even the documentation is easier. Instead of saying, there are so many mental health problems in the workplace, you're going to say, I'm getting SSQ 14 scores of this range in 37% of the workplace. Okay. I want to close just these few words by saying this program is only going to make sense if we make use of it, if we implement it. And how are we going to know that it's taking shape? It's when you document. Document anything and everything. Don't even undermine even just that one casual, let's go to the boardroom, what is it? Document. That way, we will know the size of the problem and we will know what resources are required to support the program. Does that make sense? Yeah. I know that when we were discussing with Dr. Makoni, trying to figure out what the impact of the program is, and we were asking, so what are the numbers? And he said, no, hold on. The impact is yet to come. We can actually see that the impact is coming. You can feel it, can't you? Yeah. Right? So we will only be able to know. The importance for documentation is that then we'll be able to mobilize more resources. When you quantify the problem, then you can mobilize for resources. But if we don't know and we are saying many, so many, it's not helpful, okay? So, my final words, go and offer the services. The last final word, go and offer the services. Thank you.
Thank you, Mr. Lecturer. Thank you, Selector.